Welcome to New London Hospital. I'm Elizabeth Durazio, and today I'm joined by Dr. David Lawlor. He's an ophthalmologist, and he's coming here new to our practice, and he's going to share with us some of his expertise as he comes to meet all of us and give us the best care he can for our eyesight. Thank you for joining us.
Welcome. Thank you.
Welcome to New London Hospital. Tell us a little bit about what brought you to this area.
I affiliated with Dartmouth last month. I have a fellowship training in glaucoma, and they were looking for a glaucoma specialist, so I joined the main hospital there, and as part of their outreach, they were asked to provide ophthalmologist for the New London area as Dr. Barban retired, and happened to be an opportunity that I could fill in part-time down here and part-time in Dartmouth doing my glaucoma specialty 2 days a week and 3 days here.
That's very important that you mentioned that. You know, he's very well beloved in the community, and you have a very good relationship with your clients because you're used to actually working in private practice. So tell us how you're going to bring that approach here to working at New London Hospital.
Sure, I think hopefully have a little more time to spend with people. I think a little more one-on-one time. If you go to a large teaching hospital, you get very good expertise there. There's a lot of really sharp people. And if you have something really wrong with your eyes, you need that expertise. But a smaller community, you don't have as many stops in the exam. So if you go to a large hospital, you're going to see multiple technical people and testing, and it's going to be a longer visit. Here, hopefully, we can get more directly into the patient care, be a workup with a technician, and then go directly towards me. But that's partially because the cases tend to be a little less complicated in a small area like this, and you can spend more time with the one-on-one time with the patients. Which
is so important when talking about eyesight. Now, you and Dr. Moorhan make a really good team because he really specializes in the cataract care and you specialize in glaucoma.
Correct.
Could you perhaps, tell us, a lot of people have either put off, their care appointments or things like that, maybe to get people to remember, get your eyes checked.
Sure. Yeah, so cataracts, retina problems, those tend to be very symptomatic. If you have a problem, you're probably going to know it. With glaucoma, it's extremely asymptomatic, meaning you don't know what's happening until it's very far along, and it can only be stopped. You can't get your vision back. So if you have glaucoma and you wait until you lose your vision, yes, we can hopefully save what you have, but we can't get the lost vision back. So if you learn about your glaucoma before you have symptoms, and we can stop it, which we usually can, you can maintain good vision despite having fairly significant glaucoma.
Your background is quite impressive. Tell us about what brought you to New Hampshire.
Well, I've been in northern New England most of my life. I was born in Burlington, Vermont, and actually I'm a third-generation ophthalmologist. My father was a children's eye doctor in Burlington, and my grandfather was an eye, ear, nose, and throat specialist, but he did mostly ears because they didn't have antibiotics for most of his career, so they did ear infections and things like that. So I worked for what at the time was Fletcher Allen Healthcare, UVM's program now. I worked there for 6 years and decided to go into a smaller community. I worked about 15 years ago. I went to northern Vermont, a place called Newport, Vermont, which is right on the Canadian border.
Oh, wow.
And I was there for 15 years in a small private practice. I ended up doing quite a bit of glaucoma just because of turnover in glaucoma specialty care in Burlington and Hanover. There were times when there was no coverage for glaucoma here, so people would come up to see me. But since they've been reestablished fairly well with glaucoma both here and in Burlington, I was doing more general ophthalmology. So I did a fair amount of cataract surgery too, but I still maintain a pretty strong glaucoma practice. It's much more common now as people are getting a little bit older, and their glaucoma tends to progress a few extra years, and it can become more of a problem for them.
Thank you, Dr. Lawlor. And the great thing about New London Hospital is with specialists like Dr. Lawlor and Dr. Moorhan with their expertise in glaucoma and cataracts, we know that with regular visits and eye care, we can see well into the future.